you guys about the new cases over the weekend. They were all young people, and it sounds like they were community acquired. The definition of community acquired is you don't know where you got it, but you got it. So if you could contact trace and say, that's who gave it to me, that's better than if you can't contact trace to say, that's where I got it from. So this being community acquired, the cases that are being admitted means that there's, you know, several times more that are in the community that are community acquired. Remember also what I said last week on the press conferences, where it was that the health department had not even started contact tracing any of the cases that were listed as probable, and the word probable is confusing because those are still the positives from the antigen test at Signature Care. They are listed under probable, but they are positives. So all the probables and the confirmed PCRs all are positive patients. So they hadn't even touched those for contact tracing. So those people were out there too. So it is safe to assume. Before we used to be able to say, assume that it's out there, but you don't have to assume anymore. It's out there. And that's what you need to know, and that's what you need to be careful about as you get out into the community. So to reiterate, the best thing you can do is masks. The next best thing is social distance after the masks. And the next thing is to wash your hands. So if you're going to walk away with just 3 things to do, definitely do those 3 things to protect yourself and to protect others around you. There are going to be more admissions just because there are going to be more patients in the community with the disease. So even if you take a very small percentage of those people that will require hospitalization, there is going to be more admissions. Our COVID unit currently can hold 15 patients. And I think MCH, did you guys say around 30-ish in your COVID unit? So we're halfway there already. So by the end of next week, if it keeps rising the way it does, we will be full by the end of next week. And then we'll go into our surge plans and try to see where else can we accommodate people, where can we pull the staff to take care of these people. And that's not going to be easy for us. So just want to tell the community that this is more than past the stage of having to worry. This is definitely worry, and know what to do to make sure it doesn't get worse. So that's all the message I have, Trevor. Thank you.
Thank you, Dr. Saravanan. Commissioner Shelton, do you have any numbers yet? I know they've updated, looks like, some of the numbers on the website.
Yeah, they haven't sent them to me yet, but I want to kind of follow up on what Dr. Saravanan had said about the important things to do. The mask, the hygiene, and social distancing, all those are important. But as the cases are rising and as the exposures are rising, more and more businesses are getting people, employees that work there. Okay, so they don't know what to do. And as the contact tracing team reaches out to them, they certainly are having some difficulties getting all the people that they need to talk to. And some people aren't calling back. Some people, just aren't forthcoming with them, and so they're getting a little bit of frustration. But what I want to do is I want to encourage business owners and managers, if they have an employee that has been exposed or even tested positive, call the health department. Educate yourself on what you need to do to protect the rest of your staff and or the public that comes in to use your business. I mean, self-educate, do the best you can to do your part in keeping our community safe. And I do have the numbers here, Trevor, and I'll go over those now. The positive cases, our total case count is 572. Confirmed are 359. Probable are 213. Negative are 3,982. Pending are 500. Recovered are 228. Deaths are 7. Our total tested are 4,841. And we've contacted 2,667. The number of cases received from Friday after 3 to Monday before 2:30 has been 96 total cases. The health department will be adding a new dashboard to the COVID-19 website starting today. The dashboard will have daily, Monday through Friday, updated information on patients currently hospitalized, patients on ventilators, patients in ICU, and this information is provided to the health department from each hospital to allow the community to view daily. The health department has seen an increase in COVID-19 cases from individuals from 20 to 30 years old, and contact tracing has linked them to a number of businesses both in Midland and Odessa that serve alcohol. And the health department recommends that if you're around anyone 55 or older, that you always wear a mask. So it's extremely important that as we open up our community, that we're responsible to protect those that we're around. And if you've tested positive or been exposed to somebody that has tested positive, self-isolate and contact your physician or the health department. We do have a nursing home update also. The Focus Care of Odessa, total cases 14, and this number includes 1 death. Deering's nursing home is 1 case, and that's a staff member. Sienna nursing home is 4 cases, and they're all staff members. So that's the numbers from the county, Trevor.
And it looks like we dropped off Facebook, so I'll probably have you just read the numbers again here in a little bit, but we'll go ahead and get to media questions. So first up is, looks like is Mike Merlot.
Hey, Mayor Turner, do you have any update on the free mobile testing?
Yes, we are going to vote on that tomorrow night. It's actually CARE money, so it's from the federal government, but it's going to be about $475,000, I believe, and we will approve that, and they are looking to start this week to do it in some of the parks to make it a little bit easier. But I will get Devin to get you a full copy of that, of the sites that she has already, and we can get that to you so we can start getting it out into the public to let them know that they can come and get tested.
Okay, thank you. And have any more first responders tested positive, and how are those folks, going about work? Is the city able to test those folks?
The hospitals have been fantastic to work with us, especially if it's a first responder, to get a rapid test, just so we know, so we don't send a fireman back to a firehouse or send a policeman into a meeting. And so they are either self-isolating at home, or we do still have the facilities where they can go and isolate by themselves so they don't expose their families. But if they test positive, they are off of work for a set amount of time until they test negative.
Okay. So you have like a rough number of how many folks have?
No, but I can get Devin to get you that information.
I appreciate it. Thank you. And I guess for Russell, you said that you mean you're going to require masks at MCH from now on? Is that what you mean by being more strict on the masks?
Well, we already require masks here at the hospital. I think the message that we're going to try to get to our staff is when you walk out the door, don't take your mask off. Keep your mask on. You can tell who the healthcare workers are at Walmart or Home Depot. They're the ones wearing a mask. And that when we see people, our employees who think they're exposed, they're not getting exposed at work, they're getting exposed in the public. And so we want to make sure that when they are out of here, keep your mask on and be safe, because that community acquired is where we're seeing most of these. When we have people who think they get exposed, they're not getting exposed on the 7th floor. They're getting exposed at a store somewhere. So we just want them to be extra safe with that.
Mike, I'll just add to Russell's one thing that we are going to do stepping up in the next couple of weeks as we roll this out to leadership. We'll be requiring all of our staff to be taking temperatures upon entry and exit of the building, as well as doing some attestations saying that they are coming to work and they are symptom free, so that we have that accountability with our staff as well.
Thank you. And for Dr. Sarah Vannon, correct me if I'm wrong, I think you said that 1 out of 5 people who get the antigen test receive a false negative. Why why are folks doing that test? If it kind of, does it confuse the data? Does it? It's a little unclear, right? Why are we doing that test?
I think the reason that test has become popular is because you get a rapid result. People like rapid results. They want to know now, but they're willing to make that 20% sacrifice on not knowing for sure 20% of the time. And that's why that test has become so popular. Remember, we have the Abbott test in the hospital that's almost exactly the same with regard to dynamic, right? If you get a positive, it's a sure positive, but if you get a negative, you could be wrong 20 to 25% of the time. So again, that's not one that we widely used. Once we found out that it could have a 20% false negative rate, we actually stopped using it and went to MCH and said, can you run our Cepheids for us? And now we have the Cepheid test kits, not nearly as much as how much you guys got. We actually got only 60 in, and we used 30 of those to get our machine operational. So we only have 30 right now, and they're hoping to send us more as the weeks go by. But again, we're going to use those tests, the Cepheid tests, for those that are the highest risk, which is basically the patients that are coming in that are going to be admitted to the hospital, to know for certain whether they have COVID or whether they don't. If we all had enough rapid test kits like the Cepheid, I think everybody should do the one that is most accurate. But because there is the lack of those test kits right now, people are grabbing for something. Today, I heard from our community health center that word got out that our community health center is not requiring doctor's orders anymore. Well, it does require a doctor's order. It's just all going under my name for now, because technically the CDC's criteria is so broad that anyone who wants a test can have a test. So there's no reason to screen them with questions or anything like that. You just give them a test if they think they've been exposed, if they think they have symptoms. Anything could be COVID related. So we're giving all of those people tests through our community health center. Apparently the line is long at our community health center. Signature Care, I heard the line was 3 days long, so you have to schedule a couple of days in advance if you wanted to go get that test. So I can't wait till the county and the city together can offer the mobile testing as well. That's something I'm very excited about. First of all, those would be free to the person that's getting the test. And second, there would be access outside of this setting, outside of a healthcare setting. They'd be in public places where people could access, and we could do them outdoors. We could do them more safely. So I can't wait for those to become also available. It would give us a snapshot of where our community is if we can do 1,000 of those tests within a period of time, like a short period of time, maybe within a week. We do 1,000, 2,000 tests. It'll give us a snapshot. But again, if I have to predict what that snapshot's going to look like based on the number of tests that we are doing now, that's going to show us that it is hitting our community now. Before, we weren't sure when it's hitting. Just Trevor, let me share this graph for 1 second.
See if I can.
Just take a look at this graph now. Just take a look at how that graph shot up. There's no question about it. That's where we are in the curve. Before, we didn't know where we were in the curve. Look at where we are in the curve now. You can tell for certain. It's the rapid rise, and that's where we are. This is our epidemiologic curve. So with 572, is that what Commissioner said? Look at those, and then if you scroll down here, look at the age distribution of the people that are most highly affected. So these are the people that we want social isolation, mask. These are the people that we want washing hands. These people, I think, already are worried enough that right from the very beginning, these guys decided to stay home. That's good. That's very good. If we had more of these people out there, the hospitalization rate would be a lot different than it is now. So because it's this population here, the hospitalization rate is lower. The number of people intubated is lower as a percentage. It's because of this. But we want to decrease this, and this is who we want to talk to the most and say, please protect the rest of your community. please stay home. We know that it stops your life when somebody says, oh, I've been exposed, and you call a doctor and the doctor says, stay home. Don't go out. Don't go back to work. Yes, we realize it stops your life, but think about how the bigger repercussions of you thinking you're going to continue your life, you thinking you're going to go to the grocery store or go to work, how many more people you'll expose, how many more people will be hospitalized because of it. You don't want to walk around with that. So that is who we're making the plea out to. Thank you.
And the medical community is going to start to go away from these sort of antigen tests and maybe like the Abbott or
the
is that
hospitals
an
are not
option?
using them at all, and I doubt that we'll ever start using those. We do have PCR available, and once we have that PCR available, we're just waiting for more test kits to come in to make it even more widely available. Russell, I'm sure you want this for MCH as well, but we'd like to test every patient that is going to get admitted to the hospital, not just the high-risk patients. We'd like to test every single one. We'd like to test every single person that's going for surgery before they go to surgery. Both of us want to do this. If we had enough test kits today, we'd be doing it today. But now we're being a little bit more selective because we have lesser number of test kits. As we get more test kits in, we'll widen that number of people that we're going to do the tests on. First, it'll be the inpatients, then it'll be all the elective surgeries, then it'll include all the outpatients. So hopefully we can expand it as we get more of the test kits.
Thank you, doctor. Appreciate it. That's all I have.
Well, Michael, I'd like to add to that rapid test, with 1 in 5 negatives being a false negative, I would just like to encourage anyone who's had that test not to go around high-risk people. Anybody that's immune compromised or of that high-risk age, just go ahead and treat it as if it is a false negative. Just to be on the safe side for their sake.
And Eddie, real quick, we got cut off for a few minutes. Can you just reread the numbers just real quick? Just the negatives, positives.
Gotcha. Yeah, today's count, our caseload is 572, confirmed or 359, probable 213, negative 3,982, pending or 500, recovered or 228. There have been 7 deaths. Our total tested is 4,841, and we've contacted 2,667. And again, a big number was our cases from Friday after 3 to Monday before 2:30. It was 96 total cases.
Thank you, Commissioner. Appreciate that. Danny, it's your turn, sir.
All right. This is for Commissioner Shelton. I was reading that the TABC is going to they revoked liquor licenses in Lubbock and El Paso and Dallas. Is the TABC doing the same thing, going to different bars and making sure they social distancing and following certain protocols?
Danny, I hadn't been in any bars, so I don't know too well, and I haven't been informed if they are or not. But I think it's a good idea. Just look at the numbers, how they're climbing, and where they're climbing from.
Would it would get to a point where you would have to mandate. If the numbers will keep rising, at one point when you have to consider mandating at least wearing masks. There's cities right now mandating wearing masks.
I'm telling you guys as commissioners, and I'm telling you guys as city mayor, do it. Stand up and make the statement and say we're going to mandate it. Even if we can't enforce it, just mandate it. That's the right statement to make.
One of the problems with the TABC in West Texas is we only have 2 TABC agents in the Permian Basin, which goes all the way down to Pecos in that area, because our district goes all the way up to Lubbock. That's something that we've been talking to Brooks Landgraf about getting more, because with the population boom we had, we needed more TABC officers to be able to work on that, just to go into the bars. Back in 10 years ago, they used to go in, work with 7-Elevens to catch the young people that were buying liquor illegally. Well, now we just have 2 agents and we just physically can't do it. And so that is one concern. I'm going to make a phone call as soon as we get off here to talk to Mayor Payton and get his pulse on some of these bars, and also talk about a mask requirement to see what they're doing. Just begin to discuss it, because it was easy when we had 100 cases a week, but we've had almost 100 cases in 3 days, 3 to 4 days. And that's, when you look at the numbers of the cities that had the problems, you look at Abilene, they had a factory where it got into, they're at 932, but we're at 572. And, the fear is you could pass some of these other cities fairly quickly because they're not seeing the rise like we're seeing.
I saw that on this weekend that Lubbock was labeled a official hotspot, that Lubbock is. When you look at the Lubbock numbers, we have more people hospitalized in Odessa than Lubbock does, but Lubbock is considered a hotspot. So it's just a matter of time before the Odessa Midland area gets that designation at this rate.
Well, Lubbock has 1,288 cases, and we're basically at 600.
Yeah, I'm not sure if you guys got to hear the numbers that the governor presented at 2 o'clock today. There were three numbers that he talked about, differences between the last half of May and the last 5 or 6 days in June. So just in the last week, the last half of May saw 1,500 cases turn positive per day. In the last 5 days now, we have seen more than 3,500 turn positive per day. That's more than double that's turning positive daily. The positivity rate, because you can say, oh, there's more tests being done, therefore we're discovering more positive. So that he listed that. The positivity rate used to be 4.5% of tests that were positive in late May, and now it's 9% that are positive in the last 5 days. So it's not just the increase in number of tests, it's the number of tests that are actually turning positive. It's at 9% now. This is Texas-wide. And the third number he listed was the hospitalizations, what Russell brought up. It used to be 1,600 per day in the last, in late May, and now it's 3,200 over the past 4 to 5 days. So if you look at those numbers alone, you can see we're more than double the number of positives that are coming in, not just because of the increase in testing, but that they're turning positive. You can look at all of that and see that we are rapidly increasing across the whole state, and we need to take it more seriously than ever before.
Mayor Turner, are you going to mandate masks?
I think it's something I want to discuss with the city council to get their feelings. But I think we need to watch towards the end of the week and see where we are. Midland right now has, in fact, that's what I was looking at, 322 cases, and we're at 572. So that's something I'm going to talk to Mayor Payton about and just see what.
So you want to talk to Mayor Payton before?
I'm going to talk to Mayor Payton. Well, because we worked together on this the entire way, but I'm going to also talk to council.
Council?
Yeah.
Is this something you'd have to talk to council about, or is that just what you want to do?
Well, I mean, it's just talk about the numbers and what they're doing going up. So it's just something that's concerning, especially when it's with the younger people.
Right.
Danny, anything else?
Well, I was going to ask, with school starting, like I mentioned last time, I mean, I saw something that, the school districts are going to be mandated to do testing or wear masks. So my question is, how can you protect kids and if there's no testing in the schools, in the school environment?
Danny, can I start with an example real quick, and somebody else can continue with this answer? But this is a good example. A patient will come to you sometimes and say, "I hurt my knee. Just get me an MRI. Get me an MRI, and I'll feel better." Well, an MRI is a diagnostic test. It tells you whether something could be wrong or not wrong, right? Now, the COVID test that you brought up, testing, right? The COVID test is a diagnostic test, tells you whether you have the disease or not. But if you can see clearly that the knee is deformed, do you really need an MRI? If you can clearly do a test on the knee and it feels fully stable, because we're taught physical exam skills for years and years and we practice them before we examine a patient as an attending physician. So if I can shake someone's knee in the right spots, give it the right stressors, and I can tell them that your knee is okay, you don't need an MRI. You see, the testing doesn't add a whole lot of value because you have to look at it from a whole picture. We are in the epidemiologic part of the curve right now where testing is not as important. The assumption that people who have symptoms most likely have COVID is more important. So that's important to understand, is when we are in this part of the curve where you're looking at diagnostic testing, it only adds value if you truly need a diagnostic test, versus now it's safe to assume if you have symptoms related to COVID in our community, you probably have COVID. And so I don't know if testing necessarily adds as much value as it used to before when the prevalence was a lot lower.
Gotcha.
Anything else, Danny?
I'm done.
All right. Scott?
Mayor Turner, hi. What number is it going to take for you to mandate masks? Is there a magic number in your mind?
I don't think it's necessarily a magic number. I think you have to look at the number of people in ICU. Because if the hospitals have to go into the next step, that is certainly concerning. Because, you know, staffing at a hospital a lot of times is challenging with nurses, you know, making sure you have enough nurses and things like that. I think ICU and hospital capacity are more of a number that I'm worried about, because a lot of people will just be fine with this. The people I've talked to that have had it, it is very serious. They felt horrible, but they stayed home and they got over it. The ones that you really worry about are the nursing homes, the over 60, you know, 65, and that's really the area we have to be concerned about, and especially taking care of the hospitals.
So if you talk to Mayor Payton today, and per his Facebook page, he's not very pro-mask. He runs with people without his mask on and hangs out at the brew pub without his mask on. Are you going to have to wait until a formal council meeting to discuss this? I mean, by that time, we could be looking at 40 people a day.
Well, we can have an emergency council meeting if we needed it. I just want to talk to the attorney just to make sure, see who actually is responsible for doing that. If it's something that could be issued as a declaration, then we might be able to do that. But I just need to make sure, you know, I really wanted to see what the numbers were today, and seeing almost 100 is a little scary.
Commissioners, the judge talked to you about mandating masks?
Yeah, we've not talked about mandating masks. I mean, I think we're still hoping that the public will heed the warnings. We'll just hear what we're saying and put the mask on themselves. I mean, that's the best alternative. I mean, what do you do when they don't have their mask on? I mean, if you mandate it, what do you do?
Well, in Marfa, they fine you $1,000.
Yeah, you have to have people that can enforce it.
Yeah. You know, we can't even, then we'd be tying up our courts with all these more people in there. You know, honestly, Scott, I would love to have a magic answer for you. The answer is just everybody being responsible, seeing that the real proof is the masks work. Nothing else really works as good as the masks, other than just isolating yourself and not doing anything, you know. So we're not going to do that. So let's, at a minimum, those masks, people tell me I look better in a mask. So, you know, so it's easier for me to wear one. You know, I just recommend everybody goes out there and wears them to protect themselves and everybody that they come in contact with.
Commissioner, while I've got you, can you help me understand what happened Friday with all of the miscommunication between the health department and Signature Care?
You know, I wish I could. I've asked that same question and hadn't got an answer. I just know that there were some miscommunications on what they were teaching the positive patients, and I don't know what that miscommunication was. But I'll continue to dig into that, Scott.
And then we got another email over the weekend to encourage 20 and 30-year-olds to be careful because they'd gone to a couple of bars either here or in Midland. But that's all the information we got. We didn't find out what bars, we didn't find out how many. And to be honest with you, that kind of information doesn't help us at all. I mean, if you want people to wear masks, I think you have to be more specific about where these little mini hotspots that are popping up are, so you can alert people, hey, if you're going to this bar, you might want to wear a mask. But just saying a bunch of people aged 20 to 30 went to a couple bars and got sick, okay, so what, you know?
Well, I understand that, Scott, too. And I think this is kind of the first effort of, hey, let's try and appeal to your senses. Let's not call any names out. Let's try this first effort of a generalized warning to the group of people and to these businesses. Hey, if you're in this type of business, hey, let's take this warning and practice social distancing, wearing masks, and understand that this is the cause of the rise in our community. Now, further action may be required, like you were saying, Scott, but I think this is the first step.
Okay, that's all I have. Thank you.
All right. Anybody got anything else?
Yeah, I got one more for Dr. Sarah Mann. Could you just reiterate what you said about next week if cases continue to rise like they are?
So we basically doubled in a week, right, Mike? So if you look at next week and we double again, you can imagine double the number of hospitalizations. We would be at full capacity and definitely working into our surge plan, which is not easy to do for either hospital. For us this morning, we talked about staffing being an issue in our COVID unit and in our ICU. And we said we're at that point where we might have to go out and look for contract labor, which you know is very expensive and hard to find at this point in time. We're going to reach out to our other sister facilities within Stewart to send us some nurses like we did for them when they were going through a surge. But the whole country is going through this. And so I don't know if they have nurses to spare to send to us. So my warning was that if we continue at the same pace that we are continuing now and we double in the next week, we will be well past our full capacity and will definitely be in our surge. And that stress indicator that Russell showed last time, it would be pretty close to red by then if we got to that point next week. So that's what I wanted to say.
Thank you. Yeah, that's all I have.
Can I make one more comment about masks? You see Dr. Davenport sitting there. He didn't make any comments today. You see that mask around his neck. He wears that mask for several hours during surgery while he operates on patients. He's not wearing that mask just to protect himself. He is wearing that mask to protect that patient from an infection. And that's very important for the community to understand that doctors have been doing this since we found out that we could give patients infections. We started wearing gloves, not just for our protection, but for the patient's protection, and started wearing masks. So when the community talks about, oh, will I get sick if I wear a mask for a long period of time? Well, your neurosurgeon is wearing a mask for 7 hours while operating on your brain. So if they're going to get hypoxic or hypercarbic or whatever it is that's out there, well, then they better not be operating on your brain. So they're fine wearing those masks for that period of time. So will you be. So that's something that you guys need to remember and need to tell the community as well. It is safe to wear a mask. It is the one thing that we know for certain that will protect the other person that's standing in front of you from your respiratory droplets, covering your nose and covering your mouth. If you can't get a hold of a mask, don't worry about it. Put anything on that covers your nose and your mouth. That's all you need to do.
Hey, Trevor, can I make a comment too? And this is one of the things that I think we tend to forget about in this whole thing. We're talking about COVID. Recognize that as we start to stress the hospital system and we start to stress, we forget about that part. We want to centralize on the whole COVID individuals, but we also have those that are having heart attacks and strokes. that need to come into the hospital. And when we start having to address it, we can't forget about those others. So it is important to think from a community standpoint. This isn't just about COVID, but it's about what we're doing as a medical community to treat the entire community of other disease processes as well. We've got to be, we've really got to watch that.
Thank you, Dr. Davenport. That's true. Nothing, sickness and injuries and stuff don't stop during COVID. And when you take away from those patients to take more care of more COVID patients, it just affects all of us. Does anybody else have anything else before we go to Russell? All right, Russell, you want to finish us off with something from the good word? I think we all need it.
Let me back up Davenport for just a second. 217 people in the hospital today, 17 of those are COVID. So 200 are non-COVID related. I mean, that's the reality of it. It is a big deal. We're not trying to downplay it, but just as you said, Trevor, I mean, other babies are born, heart attacks happen, appendix get bad. So if you take 217 and 200 of those today are not COVID related, that just kind of puts the really puts it in perspective. I got a couple of text messages while we've been on here, people asking me, would we recommend travel to Mexico right now? And I think the answer I have is probably not. Does anybody else want to comment on travel to Mexico?
Absolutely not.
I mean, that's kind of the answer. That's probably a hot spot from the CDC. So the answer to that would, if you got somebody traveling to Mexico, they come back, we think that's 14 days quarantine just to make sure before they even come back into the system. So no travel to Mexico. I'd say no to that. And then I've gotten a lot of text message and calls from our friends around us in small communities that maybe haven't experienced this big onset of COVID as the rest of us had. And I think our message to them is, we talked about this back in March. It's just a matter of time till this COVID comes knocking on everybody's door. And that just be smart, be safe, wear your mask, wash your hands, watch your exposures, keep those around you protected as well. But that this is going to affect us all, and it already has. But even in these smaller communities, where maybe there's only one or two suspect patients, it's just a matter of time till COVID makes it to your community, and then things go crazy. I mean, look at Alpine right now. I mean, Alpine rocked along for a long time with very few cases, and now they're wrapped around the Pete Gallego Center 3 times trying to get in there to get tested. So I just want to encourage these smaller communities to know that we're here for you, but ultimately you just don't panic, be safe, and just control who you're around, who you're exposing, and what you touch, and just be safe with that. So with that being said,
Russell, can we address something real quick? We've had several people. Do we want to go back to a Monday, Wednesday, Friday format for the time being with the extra amount of cases?
What does it say? What do you think?
Stacy, Mayor, anybody suggestions? I've had several people ask about that.
I'll do what everybody wants.
Yeah, that's fine with me. I don't have any problem with that. I mean, 96 over the weekend. I mean, it's on the move. So I think I just need to get good information out there.
Okay. We can come back on Wednesday and then always adjust as necessary. So
great. I don't know if I've read this one or not, but you know, we all have a servant's heart. We're all out there trying to, whether that's in a hospital setting, the government setting, even in the CBS 7 setting, we're all trying to serve folks and to get good information out there. And Isaiah 6:8 says, who shall I send? And you say to the Lord, here I am, Lord, send me. And that's who we are. We're here for him to send us and let his light shine through us. So thank you, folks, and wash your hands and wear your mask.
Thanks, everybody.